Dr. Waters here with Eddie Spine Rehab, talking about elbows. So we're going to talk about outside the elbow pain or inside the elbow pain. Tennis elbow, golfer's elbow. Lateral epicondylitis, medial epicondylitis. So we see a lot of tendonitis in these things, overuse, repetitive use, things like that. Obviously tennis, this one's called tennis elbow. This one's called golfer's elbow. Anytime we see a lot of repetitive gripping or typing or anything like that, we see some of these issues pop up. So three things that we can do for this. Obviously, I would treat it, I would scrape it, I do ART, do some things to it, needle it, things like that. But as far as self-care goes and as far as the rehab piece that I give in the office, we're gonna do three things. Number one thing is stretch it. So if it's on the outside, I want you to live in this stretch. So I'm talking 15-second holds throughout the day as much as you can. It's on the inside, same thing, inside. And that has a variation, you could do this too, but again, outside you're holding here, inside you're holding here. The second thing is going to be isometric holds. So we see this in the knee and in the elbow. It's going to help the tendon kind of remodel and repair. What I mean by that is you can do it without any other object or any other bands or anything like that. You're going to hold, if it's the outside, you're going to hold your wrist up and you're going to resist against it. So you're pushing against your hand. You're going to hold that for 10 seconds. I do 10 reps, 10 seconds, every day to every other day, multiple times. And then relax, back up, resist, 10-second hold. That's called a concentric isometric hold. If it's on the inside, same thing, here, resist. 10 seconds. Obviously, you can also use a band for that too. Loop it around, put it underneath the inside of the foot, up, hold here. Same thing, you're not resisting against that, but you need a band. Same thing here. You could use a weight also. Now, the third thing, after the concentric isometric holds, we're going to do slow eccentrics. So here's concentric. If it's the outside of the elbow, we're going to go slow on the way down. That's called the eccentric phase. Back up, slow on the way down. And we'll do 3 sets of 10 of that every day to every other day. Up, slow on the way down. That's for the outside. For the inside, same thing. Up, slow on the way down. Back up, slow on the way down. And so I'll give a variation of those depending if it's the outside. Sometimes I'll give the inside concentric or eccentric, basically negative. Or if it's the inside, sometimes I'll give the outside. It just depends on the case, depends on what the goal is and how far or how fast that case is progressing. So 3 things: stretch, concentric isometric holds, and eccentrics. Cool.